Another aspect of parenting has changed during this pandemic also, just fewer trips to the emergency room with little ones. News Channel 5's Eric Hilt has more details on the new study from Monroe Carell Children's Hospital at Vanderbilt.
During the winter season, children's hospitals are filled with pneumonia, bronchiolitis, croup, influenza.
But as the COVID-19 pandemic continued, Dr. James Antone noticed a trend at Monroe Carell Jr. Children's Hospital at Vanderbilt.
Here in Nashville, we were seeing far less children being admitted to the hospital.
That led to a national study that was published this week. Researchers found that Children's Hospital emergency department visits dropped by 42% during the pandemic. Visits for respiratory illnesses fell 62%.
And for the common pediatric illnesses like pneumonia, influenza, RSV infections in young infants, it was drastically lower, over 80 to 90%.
Researchers can't pinpoint what exactly caused the drop, but Antone says it's likely that it's driven by the impact of pandemic restrictions.
The measures taken during the pandemic, school closures, social distancing, mask wearing, very likely has stopped transmission of other viruses like influenza and RSV in young children. I think it's safe to say that that's at least having somewhat of an impact.
Now Antone hopes the data can help hospitals even after the pandemic ends.
And moving forward, this data would suggest that we should focus our efforts on community prevention in that adolescent population.
In Nashville, Eric Hilt, News Channel 5.